again, but there we go. But if things arise as I'm going on, I don't even mind being interrupted, or you can put your question in the chat and I'll address it either when I see it. I don't know if I see them very well as I'm talking with all these slides, but definitely afterwards. All right, so what am I going to talk about today? I'm going to talk to you about complementary therapies, what they are, how we understand and define them, and then this whole new field of integrative oncology. So what is it? What are we doing about it here in Alberta? Something called the Action Center. If you haven't already heard about it, I'll tell you about it, and a new integrative oncology clinic that we are just launching in Alberta. And then we'll talk about different lifestyle factors and complementary therapies like diet, nutrition, physical activity, and mind-body therapies. There's lots of other stuff I could get into, but we're only here for an hour or so, so we want to keep it manageable. And if there's time at the end, I hope there will be. I'll teach you some really simple mini breathing exercises that you can use anytime, any place. So let's look at our definition. So what do we mean by complementary therapies? So these are interventions, products, procedures, things that are not traditionally part of conventional medical care. So it's kind of a moving target. And the key thing here is that they're used alongside conventional treatments. They're integrated together. So the kind of complementary therapies we often think about are things like natural products, herbs, supplements, mind-body therapies like meditation and yoga, exercise, physical activity, nutrition and certain diets, and energy therapies, things like Qigong or acupuncture. All of those would be included under our definition. And these are distinct from what we call alternative therapies. So alternative therapies, they may be similar interventions, but they're chosen instead of conventional cancer care. So you might say, no, I don't want to do the surgery or the chemo. I'm going to try something different. So often these aren't as highly evidence-based, and they can be expensive or require, you have to go to Mexico or Germany to a clinic. And they're generally not part of what we would call integrative oncology care. So when I'm talking to you about integrative oncology or complementary therapies, I'm talking about using these in concert with your other treatments that may be recommended by your oncologist. So let's start with a little quiz here. What percentage of cancer patients do you think are using complementary therapies? So you can put your answer in the chat if you want. A, less than 10%, B, about 25%, C, 50%, so about half, or D, more than 3/4. So what do you think? Maybe just put a few answers in there. I'll take a quick look at them. We're getting a couple of B's. Well, lots of B's. So people are saying about 25%. Someone says less than 10. Okay, I'll tell you, so far you're all wrong. There's a C. All right, well, I'm going to show you the answer, because the answer is, in fact, my mouse is dead. There we go. The answer is C, about half. And this is around the world. So a big study, a meta-analysis is just like a study of studies, basically brings together all the different surveys from across 18 countries, showed a prevalence around 46% of people using complementary therapies since they were diagnosed with cancer. Here in Canada, it's around the same, about 48%. And here in Calgary at the Tom Baker, we did a survey back in 2012 and found about 47% said they use complementary therapies. So predictors of using them. So women were more likely to use complementary therapies, younger people, people who were more highly educated and had a longer time since diagnosis. So they've been living with cancer for longer. Of the people using complementary therapies, more than 3/4 use some kinds of natural health products. Why were they using them? To improve their quality of life, to enhance their immune system, to increase feelings of hope, and a minority thinking that they could use these products to help cure their cancer. So that's kind of the scene. What about healthcare providers? So what we've known for a long time is that a minority of oncologists in this study, but healthcare providers in general, even talk about herb and supplement use with their patients, and that they are not very well versed or well educated about these things. So in this study, only 1 in 3 felt comfortable advising their patient on using different therapies. In the same survey we did in 2012, we surveyed about 100 of the healthcare providers, and more than 80% said they had limited knowledge of complementary therapies and evidence for their use. So very few, only about 20% felt comfortable and knowledgeable enough to advise patients about a range of different complementary therapies. So since that time, we have done some education, and I think it's improved a little bit, but there's clearly a gap where we've got more than half of patients using these different therapies. And many misconceptions too around the benefits, getting advice from friends and family rather than evidence-based advice from healthcare providers. And patients want to use these therapies to regain control of their quality of life and coping with their cancer. They want to implement strategies that might help. But there's a lack of communication with the healthcare providers, and there's lack of knowledge on the evidence for various therapies. So what we've realized, and many other people around the world, is that really there is need for an integrative oncology program that's very comprehensive to help address some of these gaps and these needs. So now we get to the next term, what is integrative oncology? And we'll do another little quiz here. So A, it's the newer term for complementary and alternative medicine within oncology. B, it's a term used by non-physicians to promote use of natural supplements in combination with conventional oncology treatments. C, it's to integrate a variety of conventional cancer treatments, including things like systemic and radiation therapy. Or D, it's a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and or lifestyle modifications. So this one might be a bit tricky. Why don't you give it a try? Throw in some answers here. So I see a D, I saw a C. That could have been the last question. Oh, I see a few Ds. There's a C, a D, a B. Okay, so there's a variety of answers here. So a couple of these could actually fit, potentially A. Definitely not B. It's definitely not C, because C is talking about conventional treatments. But actually the formal definition of integrative oncology is D. So the Society for Integrative Oncology defines it as a patient-centered, evidence-informed field of cancer care, where we utilize these different practices alongside conventional cancer treatments. And the aims of integrative oncology are to optimize health, quality of life, and clinical outcomes across the cancer care continuum. So that means from prevention, screening, diagnosis, right through to treatment and end of life, and into survivorship. And we want to empower people to prevent cancer and become active participants, so before, during, and after. And so when we look at the elements of integrative oncology, the three sort of main areas of practices are lifestyle modifications, mind-body practices, and natural products. Today, I'm going to talk to you about the first two. I decided not to get too much into natural products because that's an entire talk in and of itself. And maybe that would be another one for me or someone else to come back to. And it also takes into account the patient's values, their individual needs, their preferences, their rights, their research evidence, and clinical experience as well. So the categories of complementary therapies used within integrative oncology, the most popular and well-researched ones are exercise, physical activity, diet, sleep health, as well as stress management. And we consider these the foundations of wellness. And then there's a number of, a real range of mind-body therapies, and I'll talk to you about some of those, but some of the common ones are meditation, yoga, acupuncture, things like Tai Chi and Qigong. And then the natural health products includes vitamins, minerals, different herbs, botanicals, maybe Chinese traditional medicine. There's lots of things that fall under there as well. So I want to do a little plug for the Society for Integrative Oncology, mostly because I'm the president actually right now. So it's an international organization founded about 20 years ago. We consider ourselves the premier multidisciplinary professional organization for integrative oncology. We have over 600 members now from around the world. And we have a very active patient advocacy committee as well, if anyone's interested in getting involved. And we have an annual conference that we run. And our mission is to advance evidence-based, comprehensive, integrative healthcare to improve the lives of people affected by cancer. And there's a commitment within SIO to rigorous scientific research and evidence-informed practice. So if you want to learn more, there is a website there that you can check out. And again, there are quite a few patient resources on there too. All right, now I'm going to tell you what's happening locally around integrative oncology. So the Action Center, it's fairly new. It formed a few years ago. It stands for the Alberta Complementary Therapies and Integrative Oncology Center. I'd invite you to check it out. Our website is action-center.ca. And it's organized here as you see it by patients and families, healthcare providers, as well as training and research. And we train a lot of healthcare providers as well. So the purpose of the Action Center is to bring together all the different things that are happening around integrative oncology in Alberta through research, educational activities, and clinical activities. And things are run by a steering committee that oversees all the different activities. And the key with the steering committee is that it's patient oriented is the number one thing, is that half the steering committee is actually people living with cancer or their support people. And another plug, actually, we are looking for new patient partners, patient advisors to join the Action Center steering committee. So if you might be interested or you know someone, you can send them to me. I've got my email at the end. And so our principles around the Action Center are that we are patient oriented. We have the patient advisors forming the bulk of the steering committee, and that determines the priorities. It's very collaborative between Alberta Health Services, different departments that provide various complementary therapy services, the University of Calgary for the research and training side. Wellspring is one of our partners in terms of community-based organizations, and as I said, patients and families. And again, there's that evidence base. We really believe it's important to base all our educational materials and advice on what the available evidence tells us. So there's 5 components within the Action Center. Just again, to give you an overview. So there's education in person and online for healthcare providers and for patients. We're actually revamping a bit of that now just over the last couple of years with the pandemic, because we did have an in-person seminar, and now we're sort of harmonizing with Alberta Health Services and trying to move some of those things online. We also, and I'm really excited about this, we're just launching a new integrative oncology clinic at the Tom Baker. It's individualized treatment planning and decision-making around complementary therapy use. And it's led by a medical oncologist who has training in integrative oncology. I'll tell you more about that in a second. And then there's in-house provision of different complementary therapies, but they come from all over the place. Like some are from kinesiology, some are from rehabilitation, some are in psychosocial oncology. There's also things in the community. So we wanted to sort of bring together all those different resources into one place where you can find information. And then the next piece is our clinical trials. So for therapies people are interested in and they're using, but maybe we don't have enough evidence to make good recommendations, we do research. And we're doing research on a whole bunch of different things. Like, well, right now, we're just finishing up a Tai Chi study. We've done some work in acupuncture. We've done lots of work in meditation and yoga, various different mind-body therapies. And finally, there's a training program called Traction, and this is for master's, well, undergrad, master's, PhD students in various different health sciences programs to train them in this area of research and practice. So again, another plug for the website. There's a section in there under the patients and families that brings together these complementary therapy resources. So it's got links to what Alberta Health Services has, links to Wellspring, as you well know, there's many programs here, links to the psychosocial resources department, rehabilitation, oncology, et cetera. So you can kind of go there and find your way to the different programs that are offered and see the breadth of things. So I mentioned the Integrative Oncology Clinic, and we're operating it as a study for 2 years, kind of a pilot. So Dr. Sophia Karim is leading this. She's a medical oncologist. She has integrative oncology training. And this is meant for what we're calling high needs patients for any type of cancer during treatment. We're sort of focusing on breast cancer to begin with because they tend to be high users of different complementary therapies, but it's not restricted. So anybody who needs to can use the program. And we're using this sort of pyramid to work our way up through the different services. So level 1 at the bottom is something everyone should get. So that's online, print, video, educational information that's accessible through the Action Center website or through AHS. And then the next level, it would be in-person group education. So like our monthly integrative oncology classes. And level 3 would be more in-depth in-person programs like our yoga or meditation that go for several weeks. Level 4 would be the individualized therapy, say like acupuncture, hypnosis, something like that you would do one-on-one. And then for really high needs patients, the Integrative Oncology Clinic to help them navigate their way through all those different services. So the objectives of the clinic are to provide people with an individualized, patient-centered, safe, culturally sensitive, evidence-based plan, which may include recommendations for different complementary therapies. We want to make sure that people are safe in the use of different therapies. And just to evaluate the feasibility and effectiveness of doing this as part of conventional care. which is actually the first time in Canada that there's been an integrative oncology clinic within a cancer center. And so we want to develop an approach that's sustainable over time that Alberta Health Services will put their stamp of approval on and keep offering for us. So to get into this clinic, which I said will be launching really any week now, is you have to get a referral from your oncology healthcare provider, but it can be anybody, you know, a medical oncologist, radiation, someone in palliative care, anyone in psychosocial, nursing, rehab, pharmacy, any healthcare provider can send a referral. There's no self-referrals to begin with because it's limited in terms of our space. So if you are interested in that, or you know someone who is, you just need to talk to one of your healthcare providers to get the referral. And so the criteria is that people on treatment, perhaps using a high number of natural health products or interested in a high number of different therapies, and maybe are not getting good advice on, you know, which ones are helpful and which ones may be even harmful. And patients who might be at risk of foregoing one or more conventional treatments and going for the alternative approach. We just want to make sure that, you know, not to stop people from doing that, but to make sure that they've got the all the different information that you need before making a decision like that. And also people who might have high symptom burden. So if they have lots of different symptoms like nausea, vomiting, fatigue, depression, some of these approaches can really help. All right, so that's sort of the intro bit and tell you what's going on locally. And now what I'm planning to do is summarize the evidence of different modalities, a few different modalities, you know, around what do we know that's actually helpful. So I'm going to focus on the lifestyle and the mind-body therapies. And I want to point you to a really useful book as well called The Mix of Six. It's the book's called Anti-Cancer Living. Actually, it's written by Lorenzo Cohen, who's a colleague of mine from MD Anderson Cancer Center, who runs their integrative oncology program. And in this book, he talks about the mix of 6 protective factors. And these are diet, physical activity, stress management, sleep, love and support, and also environmental exposures and environmental toxins. So I'm not going to cover all of those today, but I'm going to touch on a few of them. I really recommend this book. And also actually there's a program called the Anti-Cancer Lifestyle Program. I got that website later on in the slides, but you could type in Anti-Cancer Lifestyle Program and they have amazing resources around all these areas, and they have online classes, and it's really a great, great program. I can say that because I'm on their advisory boards. I know that what they offer is really high quality. So let's look at diet. It's pretty common that, you know, many patients will pursue special diets during cancer, you know, to try and sort of improve your health. But in reality, research on specific diets is almost non-existent. You know, there's popular diets in the past. It was things like Atkins, you know, these sort of like high protein, low fat diets, you know, and now it's more things like the ketogenic diet or the Mediterranean diet. And actually what we know is that specific diets aren't nearly as important as the sort of types of food that you're eating. So a good resource for this is the American Institute for Cancer Research. So they're just AICR.org, and they have great information on their website. This is just, you know, the section on diet, and it's got all these different, you know, food facts, recipes, all this kind of stuff, information on supplements and nutrients. So if you want to dive a bit deeper, that's a good place to go. But guidelines from AICR and other respected organizations have summarized all the evidence that we know in this area, and found that what the research points to is that, you know, and it's kind of boring, right? It's like what your grandma told you, eat your fruits and veggies. You know, there is no magic bullet in terms of what you eat. What we've seen over hundreds of studies is that eating lots of vegetables and fruits, eating whole grains and beans, and being more like a plant-based diet tends to be healthier. And then limiting things like alcohol, you know, to less than 1 a day if you're a woman. Try not to have any sugar sweetened drinks at all. So your pop and, you know, anything else like my daughter likes to go to Starbucks and get these fancy, you know, tea drinks, and they have as much sugar as a pop, right? And as little as possible of fast food and processed food. And most of the research says really no red meat, but the AICR recommendations are kind of like, you know, do the best you can, right? So you want to have no more than 4 or 5 servings per week, and no processed meat. So what is processed meat? any meat preserved by smoking, curing, or salting with the addition of chemical preservatives. So, you know, those are your deli slices, your salami, bacon, all that stuff. Here's your examples: bacon, salami, sausages, hot dogs, lunch meats, deli meat, pepperoni, ham. You should really not eat those things at all, you know, if it's not going to be too much of a sacrifice for you, right? We don't want you to, you know, be miserable eating these like plant-based diets. There's actually, you know, once you're used to it, really delicious foods you can make. So those are the guidelines. What do we know about the impact of adopting this way of eating on your cancer outcomes? It's a bit of a busy slide, but what this is showing is that they took studies of over 361,000 people who had cancer, who were over 60 years, and they were Europeans from 7 different countries. And what they did actually was quantify how many of these recommendations, if we go back to these, they gave them scores, you know, okay, were they, you know, they got a point if they had the recommended amount of vegetables, a point if they had the recommended amount of fruit, like a negative point if they had too much alcohol or processed food, that kind of thing. And then they looked at how this was related to death from cancer and overall mortality from, or from cancer overall and from specific types, and specifically colorectal and prostate cancer. They had enough people. And what these numbers tell you is that the more of these behaviors that you have in your diet, the decrease is your risk. It decreases your risk for death. So a 6% decrease in cancer-related mortality for each additional thing you're doing. So they're kind of additive, right? So, you know, if you're eating lots of fruits and veggies, that might be a 6% decrease in risk. If you're also cutting out the sweet sugary drinks, that further decreases your risk. Nothing's guaranteed, but that's what everybody wants to do, is, you know, improve your odds, right? So if you do eat in that way, you are going to improve your odds to some extent. So, okay, you're all convinced now, right? Going to start eating this way. How do you do it, right? If you've been eating what they call, it's actually quite funny, they call it the standard American diet, or SAD. So if you've been eating SAD, I guess you could call it the standard Canadian diet, but that doesn't make such a good word. It's difficult. It can be difficult to change, right? So there's all sorts of nutrition resources, and I've put some links on here. This first one is a quiz you can take, you know, about how healthy is your diet. It'll give you a score. There's videos. This is through the AICR that I mentioned. This other one is from Dr. Wayne Jonas, who is an integrative oncology specialist, and it has things like pocket guides that you can download and print out on different topics. This is the anti-cancer lifestyle program I mentioned. They're really great, and they have a whole course you can take for free on nutrition. And this other website, BCCT, stands for Beyond Conventional Cancer Therapies. They're great too, and they have things like the 7 healthy habits, you know, where it goes through. It's similar, like the mix of 6. So again, if you want to dive deeper with this and really seriously think about changing the way you eat, these are some good resources, and there's recipes and all that kind of stuff too. All right, so now we're eating healthy. What about physical activity, right? Yeah, we have to move our bodies. So it used to be, you know, back in the day, that people were like, oh, you got to just rest and, you know, take it easy. And, you know, you don't want to do any activity when you're recovering from cancer. Well, what we've learned now is, and I imagine you've had speakers on this, like maybe Nicole Koulos-Reed or someone like that, you know, talk to you about the recommendations now, which are kind of the opposite, is to move your body as much as you can. It's safe and beneficial across all stages of cancer, from prevention right through survivorship, even during treatment. And the problem is that just very few people, cancer patients, but also the general population, right? Very few people meet recommended minimum guidelines for exercise. You know, and I'll give you one resource that you may already be familiar with at the end. But we know we need to be active, and that doesn't mean running. It can mean walking. It can mean stationary biking. It can be swimming. It can be aquafit. It can be dancing. There's many different ways to move our bodies and get our heart pumping. So if I have to convince you further, studies have shown lots of benefits around self-esteem, improved symptoms of depression and anxiety. You actually feel better if you're able to exercise. It maintains your muscle mass, and no one wants to lose muscle mass, which kind of happens with aging anyway if we're not active, and can be accelerated by cancer treatment and, you know, inactivity. Exercise reduces the risk of osteoporosis, which is weak bones. It can lead to fractures. improves symptoms like chemotherapy-induced peripheral neuropathy, that's CIPN. So if some chemotherapies make your fingers and toes feel numb or tingling, exercise can help a bit with that. And lymphedema is the swelling in the limbs if you've had your lymph nodes removed. It improves fatigue. Exercise is actually the strongest evidence-based treatment for cancer-related fatigue. And it improves your balance, lowers your risk of falls. So all good reasons. It's also most likely going to help you live a little longer too. So what this is showing you in this graph here, if you can see my mouse, but the person sitting here in the purple chair, that's kind of your reference group in terms of risk for mortality. And then the green line here shows a person who's walking. And the more you walk, the more you decrease your risk up to 40% less than the person who just sits, depending on how much you're doing. And so this one here with the red is about a 31% reduction in risk. And this is just 2.5 hours of activity per week, or 30 minutes a day. So that's why the recommendations I'm going to show you start there at 30 minutes a day. But if you do a little more, you might get more benefit. And the blue line is if you're running, you're doing more vigorous activity. It doesn't have to be running. And the definition of moderate or vigorous is individualized. So it's what does it take to get your heart rate to increase a certain amount, right? So if you're in the middle of treatment, I mean, literally walking up and down the hall is going to be moderate or vigorous exercise, right? Going up and down the stairs a couple of times when you're in recovery. So it doesn't mean you're running marathons. You might just even be walking around the block. You might just be literally walking up and down your hallway, and those things all count, right? That's all part of this. So if we look at the guidelines for exercise, again, from these organizations, based on this research, it's a minimum of 150 minutes of moderate intensity aerobic physical activity per week. There's been a debate about weightlifting and more resistance-based activities, but there's consensus for sure that aerobic activity and moderate intensity is just enough to get you breathing a little hard, but you can still carry on a conversation. You're not panting and wheezing and dying. So it's like a brisk walk for most people. That's moderate intensity. That's all you need to do. And again, whatever it takes, depending on your baseline level of fitness, to get your heart rate accelerated a bit, that counts. That's your moderate intensity. Or if you're going to do more vigorous activity, you get to do less, right? So if you're going to run for 20 minutes, it's as good as walking for 30 or 40 minutes. So it's really your choice. And again, it can be any kind of activity. Some people prefer low impact things like swimming or aquafit. That kind of thing is just as good. And you should do at least 10 minutes at a time, right? So, just maybe 2 minutes isn't as beneficial as doing a 10-minute walk. So you can do a 10-minute walk, 3 times a day, right? If you have a dog, you have to do that anyway. So that's why pets are really good for your health. So the latest research is looking more at physical activity during cancer treatment, and that was more controversial. But studies have accumulated now to show that it actually improves people's quality of life. They feel better, both physically and emotionally. There's less depression and anxiety, less fatigue builds up. And those other kind of symptoms like lymphedema and neuropathy and pain are less if you're able to exercise even a little bit during treatment. So there's brand new guidelines. This literally came out like last week or something, where they have summarized all the evidence on exercise, diet, and weight management. And this is published in the prestigious journal of Clinical Oncology. This is a journal run by the largest society of oncologists in the world, called ASCO, the American Society of Clinical Oncology. They just had their conference. They literally have 40,000 people show up at their conferences. So these guidelines, the bottom line basically is that oncology providers should recommend aerobic and resistance exercise during active treatment with curative intent to mitigate side effects. So that is a clinical practice guideline. And these are very powerful guidelines that go out to all the oncologists, and they should be now providing that advice. Takes a while to get, into practice, but that's the recommendation. And the other one, the other sort of big recommendation from this is looking at preoperative exercise. And they specifically said patients undergoing surgery for lung cancer, but we know that's actually the case for breast cancer as well. And it may be for all types of cancers. And the evidence shows that will reduce length of hospital stay and complications after surgery. So they call this prehabilitation. So doing exercise in preparation for your surgery. And it gives you something to do in that horrible period of time between diagnosis when you're waiting, right? Waiting for surgery, waiting for treatment. So how do you do it if you're not already an exerciser? We're so lucky in Alberta, we have the ACE program, the Alberta Cancer Exercise Program. I bet many of you have heard of it or done it. There's a website here. You can just look it up, actually, Alberta Cancer Exercise. I just sort of looked at their page. I think have already started their spring session, but they have rolling sessions going all the time. It's free for anybody. You can take this program. They used to be in person. I think they're back in person at the Reach Center down at the Holy Cross. You actually go in a couple times a week. You get a personal trainer. They show you how to do the different activities. You do it with a group of people. It did go online during the pandemic, and I'm not sure now if they have it both ways or not. Maybe someone here knows. You could tell us. All right, so now we're eating well. We're doing our physical activity. We got to manage our stress. We got to deal with our mood. That's kind of how the mind-body therapies are good at doing, help us deal with all the different fears and uncertainties and emotions that we're going through. So what are mind-body therapies? These are a whole variety of techniques. They enhance the mind's capacity to affect bodily function and symptoms. And this is a recognition of the interconnectedness among all symptoms. So every state of mind is a state of body. Right? Our nervous system, our thoughts and our feelings talk to our hormonal system, talk to our immune system, talk to our gut. It's all interconnected. So every state of mind has a state of body and vice versa. So why do people like mind-body therapies for stress reduction and symptom management? Well, I mean, number one, they're not a pill, right? Who wants to take another pill? Typically managing side effects like fatigue, like insomnia, like pain, it's pharmaceutical. You'll get your painkillers, your stimulants to help with your fatigue, sedatives to help you sleep, antidepressants to improve your mood. I mean, these things come with side effects. They might interact with other medications. Not that they don't have their place, but a lot of people prefer to start with the mind-body therapies or maybe use them together. So many people do prefer these non-drug alternatives, but what do we know about them? How beneficial are they? Well, you may be surprised, you may not be, to know that there's a lot of research out there, and actually we do a lot of it here. So I'm not going to go through everyone separately, although I do have a talk where I do go through all of them separately. I think I might have given that talk last year to Wellspring, I'm not sure. But in summary, this is a paper that my team wrote a few years back, where we looked at mind-body therapies, including relaxation, imagery, hypnosis, yoga, meditation, Tai Chi and Qigong, and art therapy. And we reviewed the evidence about their efficacy. And this table basically summarizes the bottom line. So for each of the different therapies, I often say, people say, well, which one of these mind-body therapies should I do? Which one's the best? The best one is the one that you do and will continue to do, right? So all of these are going to be beneficial to some extent. Choose the one that you can see yourself doing and continuing to do. So the strongest effects are the areas where there's been the most research, but there's other possible effects too. And these different therapies have rarely been compared head on to one another in the same study. So we know that relaxation and imagery helps with mood, with depression. CINV is chemotherapy-induced nausea and vomiting. So if you're, thinking about your chemotherapy and you start to feel queasy, that's where relaxation imagery can help. And you can see other possible effects of these too. So for hypnosis, it's really good for pain, actually, and anxiety, and also this sort of conditioned nausea and vomiting that happens when you think about walking into the cancer center. Meditation has lots of evidence for stress, anxiety, depression, quality of life. Yoga as well. Tai Chi, Qigong seems to be particularly helpful for fatigue and helping improve balance. And art therapies can really help with mood and depression and quality of life as well. All right, so this just shows you a little bit more depth around the mindfulness-based meditation interventions. And that's another talk I give. You may have seen it. I've given that to Wellspring as well, because I do run all the mindfulness programs. But we're not the only ones who have studied this. There's actually been, in this review, there was 29 different randomized controlled trials. So that's sort of your gold standard study where it compares your intervention to either usual care or another intervention. With over 3,000 participants around the world. Most of these studies have been done with women who have breast cancer, so we know a lot about how they respond, not so much about other types of cancers, not so much about men, not so much about different groups of people. But what we do know is that the different mindfulness-based interventions improve distress at post-intervention and at follow-up, so it lasts for a while. And the main areas of improvement are anxiety, depression, fear of cancer recurrence, a common problem for people, fatigue, sleep, and pain. So there are clinical practice guidelines for integrative therapies in women with breast cancer that have been endorsed by this big organization, ASCO, that I talked about, all the oncologists. And they grade the evidence. Grade A is the best, right? The strongest evidence. So meditation has grade A evidence for mood and depression, and it has grade A evidence for anxiety and quality of life. So those are very strong evidence-based recommendations. And the recommendation is that oncology providers should recommend meditation for treating those problems. And so luckily we have them. We have these programs. So we have them at Wellspring, and we also have them at the Cancer Center at Tom Baker. It's called Mindfulness-Based Cancer Recovery. That's sort of the brochure. This is just a picture of the sign up page for the program. It is online now. The sign up is online. We've been doing the programs on Zoom for the last couple of years. Not sure what's happening in the fall yet. You can get to this page from the Action Center resources, or you can just search it up. So mindfulness is available at the Tom Baker and at Wellspring. And in fact, Michael Specka and I, who developed the program, we trained the facilitators who were providing the program at Wellspring as well. All right, another great option is yoga. So yoga, it combines movement, breath, and mindfulness. It's really, we call it mindful movement. It's part of the mindfulness-based cancer recovery program as well as training in meditation. And this helps to regulate your autonomic nervous system and your mood. So it's good to know that there's different styles and types of yoga. And a good way to think about it is that each type has different amounts of physical elements and spiritual elements. So some of the yoga types are much more strenuous, right? Like things that might be called hot yoga, Bikram yoga, Ashtanga, flow, vinyasa. These are all the more strenuous athletic kinds of yoga. The kinds we do and that we studied for people going through cancer are called restorative yoga or therapeutic yoga. They're easier, they're less physically strenuous, it's slower movement, more gentle postures. And then you consider the spiritual elements. So how much focus is there on meditation and breathing exercises called pranayama? Is it very sort of westernized? Is it more like a physical activity, or does it have more of these more spiritual or traditional elements? And you can, look around, shop around a little bit and find the best blend for you wherever you're at. So I like this cartoon. Relaxing pastime, spiritual path, or extreme sport. I think that's up to you, right? You can get many different types of yoga. So similarly, the evidence for the benefits of yoga, there's a nice review that came out a couple of years ago that had 29 different studies of people during treatment, after treatment, and mixed. And the outcomes that are often looked at are quality of life, stress and distress, as well as fatigue, sleep problems, and even cognition, that brain fog or chemo brain that is quite common. And again, in here, most of the studies are with breast cancer and, a real range of different types of yoga interventions. And so yoga is also included in these guidelines. It's a grade B evidence for anxiety, just because there aren't as many studies, and grade B for mood and depressive symptoms and quality of life as well, and fatigue. So not as high a grade just because there isn't as much evidence. So great, you want to try yoga? How do you do it? Well, you go to Wellspring, or you come to kinesiology at University of Calgary. So it's all over the city in community-based programs through something called Yoga Thrive. And so Yoga Thrive is a specific research-based therapeutic yoga program, and it's specifically for cancer survivors and their support people. So it's a very gentle form of yoga. It's a 12-week program. It's modified for people experiencing stiffness, pain, stress, and fatigue. And there's been lots of research we've done to show benefits, just like the ones we summarized. So mood, stress, strength, quality of life. There's a website there you can look, you can find the information, and a phone number there as well. So I'll share these slides afterwards, and Rebecca can email them around to everybody who's registered, and you'll have all those links. Tai Chi. This is, kind of newer, I guess, for a lot of people. And it's often combined with Qigong, which is also a form of traditional Chinese martial art. And you've probably seen people doing Tai Chi, it's a flowing series of movements, and what they're doing actually is focusing on energy and sort of moving energy around through the body. And you focus the mind on the movement, sort of called the form, and it brings about this state of mental calm and clarity. And it's very popular, and it's been studied a lot, not only in cancer populations, but people like elderly people with all kinds of different conditions. And so through that research, we know it helps with balance and preventing falls and improving overall well-being as well. And we just conducted a study with a simplified version of Tai Chi Qigong. It's easier to learn. And we don't know the results yet. So we're going to be analyzing that data soon to see if in our group here in Calgary and Vancouver, we have those similar kind of benefits. All right, this is good. I made it through all that material. I wasn't sure how long that would take. You guys are probably tired of listening to me talk. So now we're going to do some practical mini breathing exercises, things that you would probably learn in a yoga class or in a mindfulness meditation program. Now we're just going to look at the wave for a minute here. And what I would like you to do actually before we do the specific breathing exercises, let's just take a minute actually to tune in to our breath. So you can imagine your breath kind of like a wave, rising and falling in the ocean. And I don't want you to change your breath in any way. And it might be useful to put one of your hands on your belly. Don't worry about, how big you think it is. Let's just let that go. And let's just pay attention to our breathing for a moment. And what we're going to do is first just pay attention. So notice the in and the out. And notice how long those breaths are. So you may find that, one part of the breath is longer or shorter than the other. And so first, let's just see if you can allow the breath, and don't force it, just allow it to become even. So that your in is about the same length as your out. First they become even, and then you can just allow them to become a little bit longer, perhaps. And you might even add a count onto that. So as you're breathing in, maybe you can count up to 3 or 4. And a similar count as you breathe out. And if you've got your hand on your belly, as you breathe in, you may feel it swell and sort of rise up a little bit. And as you breathe out, the belly just drops down. And so we want to find a comfortable, even, smooth in and out breath. Okay, if your eyes are closed, you can just open them and drop down your hand. And you might even note how that felt. So what we were doing there, first of all, was just paying attention to the breath, but then allowing for more even, deep, what we might have called belly breath or diaphragmatic breath, just letting the breath fully fill up the lungs and then fully leave the lungs. And that just physiologically serves to exchange the oxygen and the carbon dioxide in the breath and in the blood more evenly. So if you want, you could put a note in the chat about how it felt to do that. Oh, I see a comment about ACE. It's a combination of in-person online. Yeah. Calming, someone says. So we're going to next talk a bit about the physiology of the breath, and then I'll show you a couple of other breathing exercises. So to understand how we can use breathing to our advantage, first we need to understand the relaxing, someone says. Yeah. We want to understand the interface between the breath and the nervous system. So first of all, our overall nervous system is broken down into voluntary versus automatic or autonomic, it's called. And so anything that's like voluntary is like, I decide I'm going to raise my arm, right? Okay, I'm thinking about it, I'm going to raise my arm, I do it. That's a voluntary movement that's controlled by our nervous system. But so many things that our nervous system controls are automatic, like breathing, right? We don't have to tell our lungs to breathe. We don't have to tell our heart to beat, right? We don't have to tell our glands to secrete various hormones. We don't have to remind our colon to digest our food, right? It just happens. And that's a good thing. Those things are controlled by our autonomic, our automatic nervous system. That's the big A. Now, within the big A, the autonomic nervous system, we have these two, what we call branches, the S and the P, the sympathetic and the parasympathetic. So you can think of them like they're a teeter-totter, right? The sympathetic, when it's activated, that's our fight or flight. That's the, oh my gosh, right? Where you're driving your car, dog runs out, you almost hit the dog, you slam on the brakes, right? Well, all of a sudden your heart's racing, your hands are sweaty, your muscles are tense. That's your fight or flight reaction. That is controlled by your sympathetic nervous system. It kicks in very quickly when there's a perceived threat. So we have that fight or flight, we have arousal in the nervous system, we're prepared for activity, right? To fight something or to run away. And so the other side of that, so when that happens, it suppresses the parasympathetic, that's the P. The parasympathetic, the other arm or the other branch of our autonomic nervous system, that's the rest phase, the relaxation, the possum, the sort of floppy where you lose the muscle tension. And this is where what we call it rest and digest, right? So when your sympathetic arousal, everything else is put on hold. Your stomach isn't digesting your food. That all that stuff is saved for later. You're not having a nap, right? So when the parasympathetic kicks in, that's when you can rest and digest and have that relaxation response. So for optimal health, we want these things to be balanced. More or less, when we need to have that arousal, there's some threat in the environment, our sympathetic nervous system kicks in, but then when the threat has gone, it comes back and you have this balance. When it's time to go to bed, your parasympathetic nervous system is more activated. Now, the problem tends to be that often we go through life out of balance. For many people, we're just stressed all the time. We're worried, we're tense, right? There's one after another threats. And so we never get to neutralize that. And so we have too much sympathetic activity. Or if you're really feeling fatigued and drained and tired, you maybe have too much parasympathetic and you need that jolt of energy. So the neat thing about this balance is that even though it's in the autonomic or automatic nervous system, we can still control it because there's one system that's both automatic and voluntary. What is it? It's the breath, right? You don't have to remind yourself to breathe in the middle of the night. Your body breathes, but you can also, like we just did, change the way that you breathe, right? How long, how deep, and what way. And so that is how we tap into our autonomic nervous system. That's how we balance out this energy, the sympathetic, the fight or flight versus the relaxation. We use the breath, or we can use the breath. And the neat part about this is that each part of the breath is connected to one arm of the nervous system, which is which? Well, it says right here on the slide, but normally I would ask you, which part of the breath feels more energizing? Which part of the breath feels more relaxing? Right? And the answer is right there. The in-breath is associated with the sympathetic nervous system. So if you think about it, when you're panicky or something, you're like, you're having these like big kind of in-breaths. And then when the threat passes, you might have a great big exhalation, like a sigh. So the exhalation stimulates the parasympathetic. The inhalation gets your heart rate going and gets you more activated. So if we want to bring down that level of activation, we can emphasize the exhalation. If we want to find balance, we can balance our breath, and it will over time balance our nervous system. So that's the basis of these little exercises I'm going to show you. They're very simple, but they're based on that whole physiology. So this one I like, and these are balanced. The first two are balanced. So to find a sort of balance in your nervous system, keeping with the theme of the wave, right? This is just a simple exercise, almost what we were doing, where we call it riding the wave of the breath. And you can visualize in your mind's eye. You want to close your eyes. You can visualize as you breathe in, you're going up the wave, 1, 2, 3, 4, and you peak. And then as you exhale, 4, 3, 2, 1. And you try and make it smooth as you can, like a wave. So just try it for a few breaths. And, you know, if you find the wave going off the screen kind of thing, you can come back and make little infinity signs or like sideways figure eights. So just try doing that. And it may take a few breaths to find just the right comfortable rhythm of in and out. You don't want to be forcing it or going too fast or too slow. You want the slowest pace that's comfortable and even. All right, if you had your eyes closed, just open them up. So I'd be curious to hear how that felt. If you want to pop a few words in the chat, you know, and not everyone's going to find it effective in terms of feeling calm and balanced right away, and it takes a bit of practice. But you can pop a few words in there, or we can talk about it afterwards. Pleasant, someone says. Kind of hypnotizing, yeah, so it's sort of mesmerizing. Okay, let's do the next one. This is a little bit of a different take on it. It's called square breathing. And here, again, we're going to monitor our breath, but we're going to add in a pause at the top of the in-breath and at the bottom of the out-breath. And so you can imagine breathing in, say, for 4, and if it's a full square, you pause. And you pause with your lungs not bursting, but almost totally full. You just pause for, say, 2 count or a 4 count. So a 2 count would make a rectangle. A 4 count makes a square. And so you're breathing in for 4, pausing for 2 or 4, breathing out for 4, and then pausing again with your lungs mostly empty for 2 or 4. So you're sort of tracing a square. So that might be a bit trickier, but why don't you give it a try? Experiment with the best length of the pause that feels most comfortable for you, but try and have a little bit of stillness, even if it's a short pause. And as you're doing this, notice how it feels perhaps different to pause with your lungs full after the in-breath, or to pause with your lungs empty after the out-breath. All right, let's open our eyes. Someone said it's something putting them to sleep. Breathe in 4, hold 4, exhale 8. Yeah, that is actually a sleep exercise that we do. And you'll know why actually in a second. Okay, so that was the square breath. I'd love to hear how that felt. So those two were balanced. There was equal emphasis on the inhale and the exhale. And so you can use those to just sort of balance yourself out. But if you're trying specifically to relax or fall asleep, you can put more emphasis on the out breath, right? The relaxing part of the breath. And so one way to do that, it does take focus. Yeah, someone just said that. The square one tends to be more challenging because we're not used to that. So the relaxing triangle, it's the same idea. We're going to breathe in for 4, but no pause. We're going to breathe right out for 4 and then pause only at the bottom. So 2 of the 3 sides of the triangle are on the exhale and the pause with the empty lungs. And then one side is the inhale. So inhale, exhale, pause. And so what that's doing is actually emphasizing our time and our focus on the relaxing part of the breath. So give that a try. So in for 4, say directly out for 4, and then just the pause after the exhalation. All right, let's open our eyes. You guys are probably falling asleep if that was effective. So that's the relaxing triangle. And then the last one I'm going to show you is the opposite. It's the invigorating triangle. So here we're putting more emphasis on the in-breath by pausing with our lungs full. So in this case, we'll exhale for 4, immediately inhale for 4, and then pause at the top with your lungs mostly full. And what that does is emphasize the inhale part of the breath, which stimulates your heart to beat a little quicker, and it feels more invigorating. So I use this one often. Actually, the most common place I use it is when I'm driving on the highway and I'm feeling sleepy. I'll do some of these breaths, and they may have the effect to help you feel more alert. So give it a try and see what you think. Okay, let's return from that. And actually, that's the last exercise. So I would like to sort of hear your feedback on how those felt in a moment. And this is really just the last slide here with some other resources. I've already given you the Action Center website. That's my email if you want to directly contact me. And some other resources around the mindfulness-based cancer recovery program. There's a website, and if you are on Twitter, you can follow me. And there's also a Facebook page for mindfulness-based cancer recovery. And that is all. I'm just going to stop sharing. There we go. Yeah, so questions, I'd love to have any feedback on those exercises, any questions you had about that, or, how it felt.